Welcome to Baby Nursing. In today's video, we'll dive into the topic of acute inflammation, a vital protective response in our bodies. We'll explore acute inflammation and its key features, purposes, and processes. Don't miss out on this important information. Remember to like and subscribe for more nursing content. Let's get started. Inflammation is a natural host protective response that occurs against tissue insults such as infection, tissue injury or necrosis, foreign agents, and hypersensitivity reactions. Inflammation is our body's first-line defense against such insults, and it is nonspecific. While inflammation usually promotes healing, if uncontrolled, it can become harmful. Inflammation can be acute or chronic. In this video, I will discuss acute inflammation. Chronic inflammation will be covered in a separate video. Acute inflammation has a rapid onset and short duration, typically lasting a few hours or days. Its characteristic microscopic feature is the protein and fluid-rich exudate, which I will discuss later. There are four major purposes of acute inflammation: eliminating the injurious agent, preventing its spread, removing necrotic cells and tissue, and initiating the repair process. The four major macroscopic features of acute inflammation, known as its hallmarks, are redness or erythema, pain, swelling or edema, and warmth at the site of inflammation. Acute inflammation consists of two events: vascular events in blood vessels and lymphatics, and cellular events generated by leukocytes, predominantly neutrophils. The vascular events have two phases: an increase in blood flow at the site of inflammation and an increase in vascular permeability. When there is tissue injury, injured cells secrete nitric oxide and histamine, causing vasodilation of blood vessels, especially in capillaries and venules. This vasodilation leads to increased blood flow, causing erythema and warmth. Histamine also generates action potentials in pain-sensory nerve fibers, inducing pain. Increased blood flow concentrates blood cells and vessels, resulting in local stasis of blood. Concurrently, vascular permeability increases due to endothelial cell contraction or direct injury, sometimes increasing permeability and causing the release of protein and fluid-rich exudate into the interstitial space, leading to edema. Leukocytes play a role in vascular events, with increased lymph flow due to excess fluid in the interstitial space. This leads to increased proliferation of lymph vessels and possible hyperplasia of lymph nodes. Cellular events have three steps: recruitment of leukocytes from the blood, recognition of the offending agent, and removal of the agent. Neutrophils and monocytes, capable of phagocytosis, are predominant in cellular events and promote growth and repair during inflammation. Leukocyte recruitment involves three steps: adhesion to the endothelium, transmigration into the interstitial space, and chemotaxis towards the inflammation site. Adhesion occurs in three steps: margination, where leukocytes come in contact with the endothelium due to disrupted laminar flow; rolling, mediated by selecting proteins, causing attachment and detachment of leukocytes; and firm adhesion, mediated by integrins and their ligands, resulting in firm attachment of leukocytes to the endothelium. Transmigration is the movement of firmly adhered leukocytes into the interstitial space, facilitated by adhesion molecules like CD31. After passing through the endothelium, leukocytes secrete collagenases to dissolve the basement membrane and enter the interstitial space. Chemotaxis moves leukocytes towards the inflammation site following a chemical gradient involving endogenous substances, like chemokines, and exogenous substances, like bacterial products. These agents bind to receptors on leukocytes, initiating intracellular signaling cascades, increasing cytosolic calcium and GTP levels, and activating kinases, leading to actin polymerization and leukocyte movement. Leukocytes must recognize the offending agent to activate and perform their functions. They have receptors like toll-like receptors for bacterial components, cytokine-coupled receptors for host-produced substances, and opsonin receptors for proteins coating microbes. These receptors facilitate efficient phagocytosis. Phagocytosis and intracellular killing remove the offending agent. Leukocytes bind, engulf, and kill the agent using lysosomal enzymes and reactive species. Acute inflammatory response should terminate once the injurious agent is removed. Several factors contribute to ceasing the response, such as the short half-lives of inflammatory mediators and neutrophils, switch to anti-inflammatory mediators and anti-inflammatory cytokines. Differences between an exudate and a transudate also play a role. Exudate forms due to increased vascular permeability and has high protein and neutrophil content, while transudate forms due to hydrostatic/osmotic imbalance and has low protein content. In summary, acute inflammation involves a series of vascular and cellular events aimed at protecting and healing the body from tissue insults. Proper regulation is essential to prevent harmful effects. That's all I have for you today, folks. Thanks for watching. And don't forget to like and subscribe for more nursing content in the future.